We're starting to see an increase in patients from Santa Fe County. Early on, it was from the Navajo Nation, and we were receiving a lot of transfers from outside Santa Fe County. Santa Fe County has done a wonderful job of self-isolating as well as wearing masks, and I think to that point, that's the reason we haven't seen such a large surge. But more recently, we've started to see increasing numbers. Our numbers of positive cases are going up, and our hospitalizations have slightly ticked upward as well. We're starting to see people from the Santa Fe County. The good news is they have not required much mechanical ventilation. They've come in early, and we've been able to treat them successfully with the medications that I mentioned before. Almost all of it has been community spread. Some of it has been travel outside of New Mexico. Even short stays in Arizona and Texas have, our local residents have come back having contracted the virus. When asked what's the most important thing I can do now, is to continue to not gather in large groups. It's to self-isolate at home, and most importantly, to wear a mask. That is the number one thing that we can do to help protect our community and protect ourselves. And if you do have to go to work, definitely in the workplace, work in an isolated fashion, wear a mask, and frequent hand washing. I'm very confident we'll be practicing these same procedures until we have an effective vaccine that's widespread, that's used widespread. Until then, this is the only way we have to limit the spread of COVID-19. What those countries did very early on is they employed the same techniques we used here in Santa Fe County, but they held on to them longer. They opened up a lot later than we did. And not everybody in the United States, not all regions of the United States adhered to strict isolation as well as to masking. And therefore the spread took off more quickly. One of the successful ways to contain a virus is to have all regions of a country practice the same isolation techniques and masking together. When you have certain areas of the country that don't, it's very difficult to contain the virus. We experienced a great collaborative effort mid-March when it was evident that we were going to see a surge in COVID-19 cases. We assembled a team called the Peer-Based Review Team. And basically what we did is we came up with our surge crisis plan. And that entailed how we would care for patients, how we would isolate patients, how we would use our personal protective equipment, and how we would use all the testing modalities available to us. And to this day, we still meet daily to talk about issues as this whole crisis changes on a daily basis. I think the first thing we did was we decided that we were going to use a section of the emergency department, which had negative pressure rooms, to isolate our first patients. And when we'd outgrow that, we came up with a critical number to which we would move to another unit, which was our clinical decision unit, where we held even more patients. And when we outgrew that, we moved to another part of the hospital, which serves as our COVID unit today. And doing that, we were able to isolate the patients and use a standard set of staff and to be able to care for these patients and yet keep the rest of the hospital COVID-free and all of our associates safe and healthy. Over the last several months, there have been some studies that show that certain modalities may help treat patients with COVID-19. The first one that came out was convalescent plasma. And the theory behind that is that patients who've had COVID in the past develop antibodies. And if they donate their blood, the plasma can be isolated and given to patients with active COVID-19 infection. And this will help them recover. Since then, other medications have come out. One is remdesivir, which is an antiviral agent. and that helps slow down the replication of the COVID-19 virus. And that's been given to patients successfully to the point where one study showed that it decreased the length of stay in the hospital by its use. And then the third modality that has come out has been steroids. Steroids given early in the course help reduce the inflammation. And an Oxford study showed that using Decadron 6 milligrams a day for 10 days actually helps significantly. So here at CHRISTUS St. Vincent, we employ all three strategies. And of all those three modalities, all the researchers have found that when used early is best in the patient's recovery. So like the rest of the nation, we're using these medications very early in the course of the illness before the patient experiences what we call an inflammatory cascade. In the course of COVID disease, it's a very inflammatory condition that leads to multi-organ failure. And it's felt that if you give these medications together early in the course before the patient starts exhibiting inflammation and their inflammatory markers increase, you have a better chance of them recovering from COVID. So we've become very aggressive in using all three of these together in our patients, and have noticed just anecdotally, just looking back, our numbers are very small, but we have noticed that patients have less oxygen requirement, are more hemodynamically stable, and we've had less patients requiring mechanical ventilation. For the most part, most patients do qualify for all three treatments. With remdesivir, the big issue is renal failure. That's a contraindication to receiving that therapy. Plasma, there's really no contraindication unless somebody's had a really severe, life-threatening transfusion reaction in the past. And steroids, there's no major contraindications. We just need to watch their blood sugars and other signs of infection. The prognosis for a vaccine is good. The issue is the time frame of this. We're seeing now that many organizations around the world are working day and night to create a vaccine. There's some very good leads. They've done some small studies where people have been given a type of vaccine and have developed antibodies. The big question is safety and efficacy. So now they're in trials to evaluate for safety. We're not sure of the efficacy yet because we're not so sure how long the antibody response lasts. And that's going to be key to making this an efficacious medication, especially worldwide. You want a medication that doesn't require too many booster injections so that you can keep the immune response going. Kind of similar to the influenza vaccine, which is annually, because as this virus travels, it also mutates. The good news is they've looked at the mutated virus and they haven't seen any issues with vaccine efficacy thus far. The reason for that is because they're basing their vaccine on a certain component of the virus particle which doesn't mutate, but the body recognizes and develops a response. I think as the fall and winter seasons approach, we'll have to not let our guard down and even become stricter in the practices that we're practicing now. The reason is because influenza season will be upon us soon. It's going to be vital that everyone get immunized for influenza, as well as practice these isolation techniques, and as well as wearing a mask. The reason is because influenza and COVID are going to be a deadly combination and almost impossible to treat. So it's going to be essential that everybody get immunized for influenza as well as for streptococcal pneumonia, especially older folks, people who are in high-risk situations such as immunocompromised situations or in elderly homes. Their pneumococcal vaccine, their influenza vaccine are going to be up to date because those three illnesses can all occur at the same time. I would say you're increasing your risk of contracting the virus. Just as we have visitors to Santa Fe now that are coming from hotspots, we're starting to see illness. They're coming to Santa Fe and becoming ill, and we're hospitalizing them. Some of the cases that we've had here at CHRISTUS St. Vincent are people who just went out of the state for a couple days and came back. If I could pick one area where I see the most contact taking place, it's in large gatherings. And it doesn't have to be a large gathering of strangers. It can be a family gathering of 5 people or more. And we tend to see that the spread of COVID in those circumstances. I think if we all just buckle down and sacrifice just a little bit, but look at the positive things that COVID has brought about. It's brought more family time together. It's brought more time in the home. It's brought eating around the table back into practice. It's about spending time with each other. It's about learning together. You know, think of all the parents who are homeschooling. They're getting to know their kids better. It's brought about a lot more time outdoors and exercising. And so those are all the positive things that are coming out of this COVID crisis. It's brought cleaner air because less people are traveling and driving. Those things we should look at positively and realize that still have a ways to go, but if we learn to focus on those and enjoy them, we'll get through this crisis together.